Okay.
Hello, Mr. Jones. My name is Ariel. I will be the nurse doing your physical assessment today. Can you state your name and date of birth? Okay, thank you. And do you have any allergies to any foods, medications, or environmental factors? No? Okay. And are you allergic to any latex? No? Okay, thank you. How are you feeling today? You feel good? All right, and are you experiencing any pain? No? Okay. Do you know what hospital you're in? Do you know what season we're in right now? Okay, and do you know who the president is of the United States? All right, thank you. So the first thing I'm going to do is I'm going to go ahead and check your vital signs. We're going to use your left arm. Okay. So patient's vital signs were 118 over 68 mmHg, left brachial. Heart rate is going to be 70 beats per minute on left radial. Respiratory rate is 14 breaths per minute. Temperature is 98.7 degrees Fahrenheit. O2 sats is going to be 98% room air. And Snellen chart score is going to be 20 over 40. Okay, Mr. Jones, we're going to go ahead and start the assessment by checking your vision. What I'm going to do is I'm going to place you 20 feet away from this chart, and I'm going to have you cover one eye at a time, and you'll read whichever, you'll start off from the first line till you get to the line that you can't read any, or you can barely read, okay? So patient score again was 20 over 40. Okay, the next thing we're going to do is we're going to check your gait and your balance. So we're going to do the Romberg's test. What I want you to do, Mr. Jones, is go ahead and stand right next to your bed. You're going to have your feet close together, arms right to your side, and close your eyes. I'm going to be assessing your balance for about 20 seconds. Okay, after 20 seconds, Romberg's test shows that patient was having a mild sway, which is a normal finding. Okay, Mr. Jones, go ahead and walk back and forth for me. All right, patient does not have any issues with his gait. Okay, Mr. Jones, what we're going to do next is I'm going to go ahead and assess your hearing. I'm going to be standing on one side, and I want you to cover your opposite side, the opposite ear. I'm going to stand about 2 feet away from you. I'm going to whisper a phrase, and I would like for you to repeat that for me, okay? Okay, Mr. Jones, if you can cover your right ear for me. I like turtles. Okay, and if you can repeat that. All right, let's go ahead and do the opposite side. If you can cover your left ear. Science rules. And if you can repeat that for me. All right, thank you, Mr. Jones. So I'm going to go ahead and start the assessment with inspecting your head. Have you been having any issues with your vision? No. Any issues with hearing? Okay, and any trouble breathing, shortness of breath? No. And then any issues when it comes to eating? No. Have you been swallowing just fine? Okay. I'm going to go ahead and inspect your head. I'm going to look at your scalp, look for any dryness, any lesions, any discoloration, looking for hair distribution. I'm going to look around the ears for any skin breakdown. Right? Okay. No skin breakdown here. Looking at the face for any discoloration, scarring, any acne. No. Hair distribution is even. Okay, Mr. Jones, can you give me a nice big smile? All right, can you puff up your face for me? And raise your eyebrows. All right, looks good. I'm gonna go ahead and start with your ears. I'm gonna look at your tympanic membrane. It's pearly gray, minimal buildup of cerumen, and no signs of swelling. Same goes for the other side. No signs of swelling. Tympanic membrane is pearly gray and is having minimal cerumen buildup. Okay, Mr. Jones. The next thing we're going to do is we're going to check your eyes. What I want you to do is just look straight at me. I'm gonna point the light into your eyes. I'm gonna stand about 12 inches away from you. Okay. Okay, constriction looks good, and then we'll do consensual for the other side. Okay, consensual constriction looks good. We'll do the opposite side again. Okay, consensual looks good. Now what I want you to do, Mr. Jones, is I'm gonna go ahead and have you look at my pen light. You're gonna follow my pen light just with your eyes without moving your head, okay? Gonna look to the side, okay. Okay, looks good. Patient shows no signs of nystagmus or strabismus. What we're gonna do next is I'm gonna go ahead and look into your nose. So what I want you to do is go ahead and lift your, tilt your head back. Okay, patient shows no signs of septum deviation. Nose is moist and pink. No signs of discharge. Okay, and if you can open your mouth for me, Mr. Jones. Okay, mucosal membrane is pink and moist. No signs of ulcerations in the mouth. All teeth are in place. Tonsil grading is at 2. Do you think you can bring your tongue side to side for me? All right, and up and down. And if you can keep the the tip of your tongue touching the roof of your mouth. Okay, so frenulum is nice and is midline. And one last thing with my pen light, Mr. Jones, if you can just go ahead and look to the opposite side. I'm gonna check for signs of JVD. Put you at a 45-degree angle. Okay, patient shows no signs of JVD on the right. Oh, on the left, and patient shows no signs of JVD on the right. Okay, Mr. Jones, I'm gonna test just a few things on your face. What we're gonna do right now is I'm gonna go ahead and have you close your eyes. I'm gonna let me know when where I'm touching you with a Q-tip, okay? Yep, that one's on your left cheek, and that one was at your right eyebrow. Thank you. Next, we're gonna be doing the smell, where you're gonna go ahead and cover one nostril, and you let me know what you smell, okay, with your eyes closed. Okay, go ahead. Okay, what did you smell? Eucalyptus? All right, let's go ahead and do the other side. Go ahead and cover the other nostril. Okay, and yep, that was coffee. Okay, so the next thing we're gonna do is I'm gonna go ahead and palpate your head. If it's okay with you, I'm gonna palpate for some lymph nodes. I'm gonna start right over here, which is the occipital, post-auricular, pre-auricular, the tonsillar, submandibular, and submental, anterior cervical, deep cervical, then posterior cervical, anterior cervical. Gonna go up to the supraclavicular lymph nodes. No lymph nodes were palpable, so that's a good sign. Gonna go ahead and feel for the carotid pulse. Okay, carotid pulse was felt, no signs of bounding. Carotid pulse was felt, no signs of bounding. Mr. Jones, can you shrug up your shoulders for me? All right. Shrug was symmetrical. Okay, I'm gonna go ahead and feel for your arms, feel for excess warmth, look for skin breakdown, any discoloration on the arms, no signs of discoloration. Gonna feel for your brachial pulse. Okay, now your radial pulse. And then Mr. Jones, if you can push down towards my hand. All right, and then push up towards my arm. Okay, and then give you a nice squeeze. Okay, thank you. Arm strength was symmetrical. I'm gonna go ahead and check capillary refills. Okay, capillary refills were brisk, +3. What we're gonna do next is I'm gonna have you bring your arms up all the way. All right, and then bring them up to the side. We're gonna check your range of motion. Looks good. What we're gonna do next, Mr. Jones, is I'm gonna go ahead and check your pulses and your heart sounds and your lung sounds, okay? So what we're gonna do is I'm gonna go ahead and take my stethoscope, of course clean it. Have you been experiencing any chest pain? No? Okay. And have you been experiencing any shortness of breath? No? That's good. Do you drink any alcohol? Okay. And how often do you drink alcohol? Once a week? Okay. How many alcoholic drinks would you say you take a day? Okay. And do you smoke? No smoking? All right. Are you around secondhand smoke at all? No? That's good to hear. Okay, Mr. Jones. Have you noticed any difference in your bowel movements lately? No? Okay, and how often would you say you have a bowel movement? All right, once a day, and is that normal? Yes. Okay, and then have you noticed any difference with your urination? Have you been having difficulty starting your urinating? No? Any burning? No? Any weird color or smell with your urine? All right, thank you. I'm gonna go ahead and check your carotid pulse. I'm gonna see if you have any bruise in there. Okay, I'm gonna use the bell. Go ahead and look up, hold your breath for me. Okay, we'll do the other side. Okay, patient shows no bruise were heard in the carotid artery. And then what we're gonna do next is I'm gonna go ahead and check your heart sounds. I'm gonna start right onto the right side. Second intercostal space, which is the aortic valve. I'm gonna where you can hear S2 is gonna be louder than S1. To the left, second intercostal space, S2 is louder than S1. Down to the third left intercostal space, which is the herbs, S1 and S2 are equal. Down to the fourth intercostal space, which is the tricuspid valve, S1 is louder than S2. And then down to the mitral valve, where S1 is louder than S2 again. And I'm gonna stay here for about 1 minute. I'm gonna count your apical pulse. Apical pulse is 70 beats per minute, symmetrical to the left radial. And what we're gonna do next, Mr. Jones, is I'm gonna go ahead and check your abdominal area. I'm gonna put you at a supine position. Okay. I'm gonna put you in a supine position. I'm gonna look at your abdominal contour. Abdominal contour is flat, no signs of aortic bounding. Again, I'm gonna take my stethoscope, clean it. I'm gonna inspect my patient's abdomen, no signs of any discoloration, obvious masses. Okay, no signs of previous scarring or previous surgeries. Okay, I'm gonna start by listening to your aortic artery, okay? Okay, no bruits were heard. Down to the iliac. No bruits were heard. No bruits were heard. No bruits were heard. To the femoral, no bruits were heard. Okay, and then I'm gonna go ahead and listen to your abdominal sounds. Right, I'm gonna start here at the right lower quadrant. Listen for 15 seconds. Again to the right upper quadrant. Listen there for 15 seconds. Up to the left upper quadrant. Listening for 15 seconds. And to the left lower quadrant, 15 seconds. When was the last time you ate, Mr. Jones? Okay, at 8 o'clock in the morning. All right. So abdominal sounds were 16 gurgles per minute on each quadrant. Okay, we're gonna go ahead and have a seat now, Mr. Jones. Oh, actually stay laying down. I'm gonna go ahead and percuss your stomach. Okay, abdominal sounds of percussion were all timpani. Okay, go ahead and have it lie back down. We're gonna go ahead and palpate. Let me know if you have any, if you feel any discomfort or tenderness. Okay, no signs of tenderness. And then Mr. Jones, I also forgot to check your respiratories. I'm gonna go ahead and listen to that. Every time I put my stethoscope on your body, go ahead and take a deep breath, okay? Okay, let's go ahead and do the back. Okay, to the side on the fourth intercostal space. Okay, do the opposite side. Okay. Respiratory sounds have no abnormal respiratory sounds were heard. Okay, so now what we're gonna do, Mr. Jones, is I'm gonna go ahead and check your lower extremity. I'm gonna go ahead and palpate for the temperature of your skin. I'm gonna check your popliteal pulse. Popliteal pulses were felt, and then down to the dorsalis pedis, which is in between the great toe and the second toe. Dorsalis pedis pulse was felt, slightly diminished. Patient shows no signs of edema, no signs of DVT. Looking at the patient's palm, heel area, no signs of ulcerations. Okay, Mr. Jones, do you think you can bring your knees up to your chest? Okay, that looks good, and down out to the side, right in front of you. Okay, I'm gonna have you slide your heel to your shin. All right, looks good. Okay, Mr. Jones, and I'm gonna go ahead and check your reflexes now with my hammer. I'm gonna clean my hammer, wash my hands, clean my hammer. Okay, I'm gonna go ahead and check your biceps tendon. Okay, and then down back to your triceps tendon. Okay, reflex looks good on the right side. Okay, left side biceps tendon, left side tricep tendon. And then what we're gonna do is I'm gonna have you sit on the edge of the bed, have your knees hanging. I'm gonna go ahead and check your knee reflexes, okay? Woo. Okay, go over to the other side. Woo. Okay, looks good, Mr. Jones. This concludes our assessment. Is there anything I can do for you right now? Do you need anything? No? Okay, here's your call light. If you have any questions, go ahead and call us and we'll be with you shortly, okay? Thank you.